Welcome to today's webinar on the coronavirus vaccine. Thank you to all that have attended. I'm told we've got thousands of people who have engaged with the links for this webinar. My name is Dr. Dara Kapasi. I'm a GP and a clinician who sees the deadly impact of the coronavirus firsthand. The aim of this webinar is really to empower each of you to try and save a life. By accepting and encouraging the uptake of the vaccination, you are significantly reducing the chance of coronavirus causing you or a loved one to become seriously unwell or die from it. It's quite natural to have anxieties about the vaccination. However, each of us must be responsible. We have a responsibility to not share the wild, mythical and non-scientific statements which can be made against the vaccine. The evidence is clear. Doing this can have dramatic implications. If you misinform people by spreading a false rumour, and it means someone does not take the vaccine as a result, a person can die. So I would say this is your chance to obtain accurate information from our expert panel this evening. Our team together contains over 200 years of medical experience, and I'm confident this is more than sufficient to battle the silly, mythical and misinformed WhatsApp and social media posts which are doing rounds. I'm really pleased and thankful to have Professor Ivan Browne, who's Director of Public Health in Leicester City, Mr. Andrew Furlong, who's a Medical Director at University Hospitals of Leicester, Dr. Jennifer Briggs, who is working hard with a team to treat the sickest patients with coronavirus as a consultant in intensive care medicine, Trevithick, who is a Chief Nurse and Executive Director of the CCGs across Leicester, Leicestershire and Rutland, Dr. Sulaxni Nainani, who is a frontline GP and a member of the governing body of the Leicester City CCG. Finally, Mr. Zuffar is a patient representing lay member of the CCG who has worked very closely with the communities of Leicester over the years. So we really wish this to be an interactive session. If you do have any questions on the vaccine, then please place them into the chat. We've got a team of expert clinicians answering your questions on the chat as they arise. So that includes Dr. Avinash Prasad, Professor Mohammed Roshan, Professor Fahd Rizvi, and our dedicated team of pharmacists who include Sailesh Gohil, Kishan Solanki, Asma Patel, Aisha Aziz, Alicia Chand, Mohammed Das, Niraj Lakhani, and Ruma Tama. We also have Dr. Hussein Abbas and Nurse of the Year, Reena Patel. So we're going to try very best to answer the questions as they come in. As you can imagine, if we've got thousands of people on the webinar, it may be difficult to answer everybody's questions. But what we have been doing is collating the main questions patients have had over the vaccine over the last 2 weeks. And whilst they will form the mainstay of the session today, we're going to try our very best to answer some of the live questions asked by the people of Leicester. As there are likely to be lots and lots of questions, what we're going to do is perhaps send out a Q&A, which is going to go out to everybody by email at the conclusion of the session. So without further ado, we're going to go to Professor Ivan Browne. So Professor Browne, still busy in lockdown. I was very much hoping that in August we were done with it during the last webinar. But unfortunately, we're in a huge second wave at the moment. What's happening locally? What's the situation?
Yeah, thank you very much, Dr. Kapasi. First of all, it's really good to be back in this forum. I love being in this place. It's a way that we talk directly to patients and members of the city, and I really appreciate the chance that we get. So we've been here long enough. We've spoken to one another about the situation, very much with the hope of seeing those figures starting to come down. But I think it's fair to say that we were always mindful of winter. We were always concerned about winter and the pressures that was going to put on us as families and our communities, and also as our hospitals. So the current situation that we have is that we've seen, just like the rest of the country, really high numbers, putting the NHS under pressure, putting families, putting education under pressure. We are still in that place. I think over and above for the city, what I would say is that We have certainly seen a number of aspects that have now come into play. So first of all, we've got winter, but as many of you will have observed, the situation with the new variant of the virus, which is anything between 30 to 70% more transmissible, that has again exacerbated the problem and put us under even more pressure. So as we stand at the moment, I think the city has done quite a lot of work to try and keep the virus down. But along with the Midlands, I think people might have seen the reports that the Midlands is going down slower than other areas in relation to this particular lockdown. And I think that's a dual pressure. So we've got the lockdown trying to help some people, not observing that it's not the same as the lockdown that we had the first time. But equally, we now have the pressure of the new variant becoming the dominant variant that exists in the city and in the county. So that means that we are seeing numbers really sort of plateauing in the city. So what I would really say is there is still a lot of virus out there. There's still a lot of people that can pass on that virus. They can pass it on easier. So it's a really challenging time for us as a city.
Thanks, Professor Browne. And I think it's really important to set the scene because we need to understand why we need the vaccine. And if numbers are quite high locally, it means we must take the vaccine to ensure numbers come down over time. And I think it is important to set the scene before we get to the vaccine specific questions. And also, one of the aims really for this webinar is to make sure people are still engaging with public health guidance. So I just want some affirmations, Professor Browne, about the importance of following public health guidance, even though people will have the vaccine.
Right, so I think that this is absolutely critical. So we know that one of the challenges that we felt as we were coming through the winter is that will pull people together. Naturally, you go inside, you spend more time indoors. There is a risk that sits around that. So suddenly that public health guidance becomes even more important. Combine that with the transmissibility. So that issue around social distancing. When we speak about 2 meters now, we talk about 2 meters as the minimum. You know, we're really having to think how much more can we do to try and prevent that. The face coverings, you've seen a lot of the supermarkets, a lot of areas, and now start to take this really seriously. And so you will not come in without that. That's absolutely important. Winter's brought around some other information about making sure that if you are indoors, try to make sure that those spaces are ventilated, trying to make sure that those things happen, and testing still remains important. One of the key challenges that we face locally is, first of all, people making sure that they get tested and know their status. But secondly, if you do get a positive test, making sure that you isolate. You know, not being tempted to just, well, I'll just pop down, or if you're a contact, when it says isolate, it means isolate, because the problems that we've been having, I think, has been that people have been going partway through, not doing that part of it. And we know that that's difficult. We know the economics that go with it. We know all of that. But I think one of the things that's very different this time round, I mean, we are 5 times higher than we were in the summer, is that everybody seems to know somebody who has either been in hospital, been sick, or lots of people now know people who have unfortunately died as a result of this virus. So we're not talking in the abstract now, we are talking in the reality of our circumstances to say why it is absolutely critical that we follow those public health measures. And we'll be doing that for some time, actually, even when the vaccine comes on. We still have to protect ourselves and protect others.
Thanks, Professor Browne. So hands, face, space. If you're symptomatic, get a test, isolate, and follow public health guidance. And I suspect the modelling will show if we do all of this and we have mass vaccinations, we have a roadmap out of this pandemic. Is that right?
For me, this For me, this part is absolutely key. The difference when we've been speaking over the course of last year, and the difference now is that we were waiting for the vaccine. We were preparing for the vaccine. We know that it's decimated our communities. We know specific communities that have borne the weight of this awful virus. But today, we are now talking about the route map out. We're talking about vaccination. It's here. It's not in the future. It's here right now. And actually, we need to make sure that we are making the most of that. Our vulnerable communities, those that have been hardest hit, those that are vulnerable, we need to make sure that they are vaccinated. We need to be encouraging our communities to do that, because the risk that we're talking about in terms of not being vaccinated or not complying, the cost is huge. It is sickness and it is death. And we need to make sure now that we've got a way out, that we don't do anything that dilutes that in any way, that we don't lose any one loved one more than we already have.
Thanks, Professor Browne, for those affirmations. I think that they're really important reminders, actually. I think the issue with coronavirus is that it not only affects people who have it, it also affects people who don't have it, because lots of people have diseases which can't get treated because our hospitals are full of COVID. And we've got Mr. Andrew Furlong, the Medical Director of University Hospitals of Leicester, who I'm hoping is going to tell us a little bit about the state of Leicester's hospitals. So what's happening in Leicester's hospitals, Mr. Furlong, and what's happening in critical care?
So thanks, Tarek. I'm very pleased to be here tonight to hopefully, if not people aren't already, convince them that the vaccine is a vital life-saving treatment that we should all be signing up for. So winter is always a very busy time for the NHS, and particularly for our hospitals. But on top of that, we have now overlaid the COVID pandemic, and that is placing huge stresses on the NHS nationally, and Leicester is no different in that front. I think it's a stark statistic that in wave 1, which was in April, May last year, we had 206 patients in our hospitals with COVID. We currently have more than 450 patients in our hospitals with COVID. So just over 1 in 3 of our beds at the moment has a patient who has COVID in them. And in terms of our intensive care unit, we would normally operate out of a bed base of 49 intensive care beds. We currently have 62 patients with COVID in our intensive cares, and another 14 who don't have COVID, who have urgent conditions. So that means that in our intensive cares at the moment, there are 76 patients. So we are operating at 155% of our normal capacity. On top of that, we also have around a ward's worth of patients, so some 25 patients who are having advanced respiratory support. So these are you might have seen people on telly who have these devices called CPAP devices that sit across their face and provide oxygen to them. And those are patients who are also traditionally might often be on intensive care units. So we're probably operating at around 100 patients who are having some form of advanced respiratory support because of COVID, compared to our normal ITU footprint of 49 patients. And the impact of that is that in order to staff those additional beds, both on the wards and in our intensive care units, we've had to move staff around, and we've had to close some of our facilities. So we've had to take down many of our operating theatres so that we can move staff to work on our intensive care units. We've had to move staff from some of our other wards to support the additional medical wards that we've opened up, and the wards that we've had to convert from surgical wards into medical wards. I'll give you an example. We've got more than 50 of our consultants who are working on ITU, either as in capacity, not as doctors, but actually working as nurses to support patients, to support our intensive care unit nurses. So that's the impact. And what that means for people, both with COVID and without COVID is that we can't provide services in the way that we would want to provide them. And particularly for people who are waiting for planned operations, we've had to delay many of those operations now. And for some people, their operations have been delayed for a significantly long period of time, because we've been dealing with COVID for almost a year now. But we are really feeling the acute pressures of this current wave of COVID. And so, you know, we need a way out of this if we are going to go back to providing care in the way that we should all rightfully expect.
Thank you, Mr. Furlong. So clearly, we need to follow public health advice. We need to take the vaccinations, because it's going to mean that our beds are going to be occupied with COVID. And perhaps those patients who need routine, urgent, elective care for other health conditions may not get the care they need. So it has a tremendous knock-on impact. So, Mr. Furlong, have you had your vaccine yet?
I have had my vaccine, and not only that, my wife, who's a healthcare worker, has had her vaccine, and my parents-in-law who are older, who live with me, have had their vaccine, and that my mother has had her vaccine, and 14,500 other UHL staff who work in Leicester's hospitals have had their vaccine, and 27,000 healthcare workers across LLR have had their vaccine. And the reason they've had their vaccine, the reason I've had my vaccine, is I know it protects me, but I also know that it's protecting my nearest and dearest, and it's protecting the NHS.
I'm really pleased to hear that, and you look well. I can't see any obvious side effects. That's consistent with all the scientific literature, consistent with the 7 million people who've had the vaccines. And at the moment, we've not really had any significant adverse events, but yet our critical care units are filled with coronavirus, but none with the side effects of the vaccine. And for that, I'm going to move to Dr. Jennifer Briggs. Dr. Jennifer Briggs has just finished a shift in the intensive care unit. And Dr. Briggs, you're seeing the sickest patients who have COVID. What are you seeing on the front line? Can you paint us a picture of what COVID in ITU looks like?
Well, as Mr. Furlong said, you know, we've got a lot of people come to help us, which is brilliant. We normally have around 20 intensive care beds in our ITU at Leicester Infirmary. At the minute, we're nearly twice that, and the patients are all very sick. I was speaking to a colleague earlier, and he said it's the worst he's seen in 32 years in intensive care medicine. And I've not been in intensive care medicine as long as he has, but certainly the worst I've ever seen. The patients are of all ages, and I think people think that these patients are, you know, people that are already really very sick because they've got underlying health conditions. But we're not talking about people who are in the final years of their life. We're talking about people with things like blood pressure. Maybe they take one tablet for that, or high cholesterol, or they've got diabetes, or maybe they've got cataracts. These are all patients, you know, that I've personally looked after that actually have, you know, they're fit and well. They don't need help with doing day-to-day activities. And you know, over 84% of patients who've been admitted to intensive care around the country are completely independent, living normal lives, not needing any help with their daily activities. They're not people who are frail and elderly. These are young, fit, healthy people who've got years of good life ahead of them until they get COVID, and then they end up with us. And we try our best. We work so hard, and everybody is doing everything they can to look after these patients. But we're losing a lot of patients in the UK to COVID, despite everything we're doing, and despite our best efforts. And we've never seen as many people dying from this condition. But it's not even just the people who die. A lot of people who do get out of hospital are left with serious conditions afterwards. Serious lung damage, serious kidney damage, needing dialysis. They're not going back to being normal. And I think that's the thing that we forget about. Yes, we see the death figures, but we don't see as a lot of people who are losing their health because of COVID. And I know that one of our patients, Annabelle, she's been featured in some of the local news articles talking about her experiences of COVID and losing her mum in our intensive care unit while she was herself a patient. And she's been left with permanent lung damage needing oxygen, and she's not unusual in that. This is something that takes away people's health as well as their life. You know, when we heard that the vaccine was coming, the mood just really lifted. The staff are exhausted. They're doing everything they can. They're so passionate and they're so dedicated. And you know, I'm really fortunate to work with a fantastic team. But when we found out about the vaccine, everybody's mood lifted, and we were really excited to get the opportunity to have it.
Dr. Briggs, a really sober account there. And yesterday or the day before, we passed 100,000 deaths, and often I think we're becoming numb to the daily death figure that's presented on the news every day. As clinicians, we're seeing those people die and leave relatives. Some of the salient points that you mentioned were a lot of the patients don't have significant comorbidities, day-to-day conditions that we treat for lots of people. There are some segments of society, Dr. Briggs, who call the COVID vaccination schema hoax. They don't believe in it. They're propagating myth about it. How does that make you feel when you are seeing patients with coronavirus die every day?
Yes, so that's something that unfortunately is quite prevalent at the minute on social media, and it's really difficult. It's causing people to feel really despondent and sad and upset and angry and frustrated, because, you know, we're just trying to do the best thing to help our patients. You know, actually, in intensive care, if all we spent our time doing is looking after people recovering from operations, and you know, if the intensive care units were empty, we'd be really happy, but they're not. They're really full, and they're full with really sick people, and filled with people that we're trying everything, but we can't save all of them, and so it makes it feel like everything that we've been through in this last year, everything we've tried to achieve for our patients, it makes this feel like it's not appreciated, and what we really worry about is, you know, the impact that those messages have on the people that read them, you know, because it might mean that they take less care, that they don't get the vaccine, that they don't protect the vulnerable people that they live with and that they love, and it might mean that they spread the virus and that they could end up losing somebody. And we really worry about the impact both for individual people and families, but also for Leicester and for all the other people, like Mr. Furlong said, who need other treatments. And if the hospital's filled with patients who've got COVID, it means that we can't do everything else as well. So it just makes us really shocked, and I wish they could see what we see every day.
Thank you, Dr. Briggs. That's really sobering. And thank you to you and all the staff who are working ever so hard on the ITU units to keep people alive. And I really want your perspective on risk, if I may, because people worry about the risk of complications from the vaccine. But have you seen anybody in hospital or in ITU with the complications of the vaccine?
No, not at all, and I don't think any of my colleagues have. In Leicester, certainly nobody in Leicester has. I'm not aware of anybody nationally who has. You know, I think, you know, it is about risk, and it's about what we can do to reduce risk. And, you know, there's all these myths about what might happen if you have the vaccine. I had a sore arm afterwards, I had a little bit of a headache, but I didn't need to get admitted to intensive care. And since I've had my vaccine and had my sore arm, it's all got better. we've admitted a lot of patients to intensive care, and we've had a lot of people die on intensive care in Leicester from COVID. Nobody's come to our intensive care unit because of side effects of the vaccine, and nobody's died from the effects of the vaccine.
Thank you, Dr. Briggs. And I think that concept of risk is really, really important for people to understand, because people don't know that actually paracetamol has a very, very rare risk of liver failure. When we go out and drive our car to go to the local shop, there's a risk we'll have an accident. When we have a vaccine, there is a very, 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 very small risk, probably lower than having an accident in a car on a snowy day, is really quite low. So I think really what I wish to do now is go to Mr. Zuffar, who's a really integral member of the community within Leicester, and I just want your reflections on what's been said so far, Zuffar. So what's your reflections on what the panelists have shared so far?
Thank you, Terry. Leicester's been in an almost continuous lockdown for the last 12 months. So people are tired, people have fatigue, but this is actually like running a marathon, and we're being chased by this horrible COVID disease in this marathon. And part of the tools that we've got to beat this COVID is the mask, is the space, washing your hands, and vaccine is another part of it. So there's a lot of hope out there now, and the numbers of the GPs that are giving out so many vaccines. I went to visit some of the vaccination centres, and they were doing 800, 900 a day. So people are actually getting vaccinated very, very rapidly. Lots of people out there waiting by the side of their phones, waiting for that phone call, and can't wait to get that vaccine. It is a lifesaver. If you care about your family and you've got the opportunity to take the vaccine, take it, because it will protect not only yourself but your family as well. And you know, COVID is a really nasty virus, and it's claimed lots and lots of lives. Lots of people I know over the last few weeks I've lost, and I just think to myself, look, we've got to do everything we possibly can to deal with this problem. We are nearly there. We're nearly at the end of that tunnel. We can see the light. We've got all these tools in our armory to protect us against COVID. Vaccine is the last one. Everybody needs to get the vaccine and move on and move forward. I would urge everybody out. There's lots and lots of myths out there. You know, the vaccine causes you to change your DNA. It causes you problems with your fertility and everything else. All this is just made up fake news. And the reality is the vaccine is perfectly safe. People should take the vaccine, not only to protect themselves, but to protect their loved ones, because this COVID-19 is fatal to many people, and we've lost so many people over this. And you know, you've got to protect as many people as you possibly can.
Thank you, Zuffar, for those salient messages. And really, this is the biggest vaccination program in living memory. And one of the orchestrators of that within LLR is our Deputy Chief Executive and Chief Nurse, Caroline Trevithick. And I'm hoping, Caroline, you could share with the people of Leicester how we're planning on rolling the vaccines out. So, Caroline, how are the vaccines going to be rolled out in Leicester? And how many people have you vaccinated in LLR so far, if we've got those figures?
Thanks, Tarek. Can you hear me okay? Thanks for so many people joining us today. I think it's really important that you understand just how we are rolling the programme out. The first thing I need to say, though, is that this rollout is part of a national rollout. So whilst we're doing it locally, we're absolutely supported and managed by the national team in terms of rolling this out, so we can try and get it rolled out in a systematic way across the whole country. And because of that, we've seen a phased rollout since we opened the first hospital site on the 12th of December at Leicester General Hospital. The excitement on that day was just amazing, and giving those first vaccines was wonderful. Since then, we've opened 2 more hospital sites. We've got Leicester General and the Leicester Royal Infirmary, and we're bringing on another couple of hospital sites in Loughborough and Lutterworth over the next few days as they start to come online as well. Each of those sites go through a really rigorous assurance process to make sure that the precautions that Ivan was talking about at the beginning can be maintained, because although we're giving the vaccine, we've got to maintain safe distancing, etc. So those sites are rigorously controlled. In addition to that, we've got 19 primary care sites, so sites where GPs are delivering vaccines, and that's a combination of larger GP practices where we can get the big numbers of people through on a fairly rapid basis, but also we've taken over some of the local authority leisure centres because they're not in use at the moment, so we've been able to use those sites as well. And we've got a mixture of those, 19 of them across Leicester, Leicestershire and Rutland. This week we opened our large vaccination centre at the People Centre, and that's yet another opportunity for people to come in. How are people called? People need to understand how the process is going in terms, and I've seen in the Q&A that people want to know when it's their turn. We're being very much controlled by a national basis to focus on the first 4 cohorts of the people most at risk. And we started with the top category with care home residents and staff. And by Sunday, we had vaccinated 98% of all of our care homes across Leicester, Leicestershire and Rutland. It's a really positive outcome, but we know that there were some that were in the middle of outbreaks where it was just unsafe to go in at that time, but we've got a plan to follow those up, so that's great. The second cohort were over 80s and health and social care staff, and Andrew spoke and Jennifer spoke about the numbers of staff that absolutely need to get these vaccines, not just hospital staff but frontline staff that work in social care as well. And we've got over 77,000 of those staff that to get through and get vaccinated. So over 80s and those health and social care staff are next. Then over 75s, and then the over 70s and the extremely clinical vulnerable. Because we've had a phased rollout, we have seen that some areas have got through those cohorts quicker than others, and also there are some areas of the city particularly don't have large numbers of over 80s, so they've been able to move through their cohorts a little quicker. Or they've been giving mutual aid, supporting their primary care colleagues in getting through those areas where we've got larger numbers of staff. The aim is to vaccinate all 4 of those cohorts by the 15th of February, so that's 2 weeks away. That's not long. The numbers of vaccines we've given to date, the published figure is about 61,000, but I can tell you we've done many tens of thousands more than that. That last data was 21st of January, and we've had rapidly increasing numbers of vaccine coming into the system on a day-by-day basis. And any vaccine that's coming into the patch, we are making sure it goes straight out. We're not sitting on any vaccine at all, because we really want to get these vaccines into the arms of people and vaccinate them. So people want to know how they're being called. There's a couple of mechanisms, either through a contact directly from your GP. That's happening by text, by phone call. Some of the GPs have been knocking on doors because we've had fairly short notice of when some of these vaccines are coming. So we've had to do a rapid turnaround in terms of booking people in. And so we've been using any means available to us. And we've also got the national booking system, where the national process will mean if you fit into one of those categories and you haven't received a vaccine, you'll get a letter allowing you to book into one of the vaccination centres. This week, I know that we've had some media support this week because we've had an opportunity to get patients vaccinated through the hospital hubs, and that's kind of worked really well. It got us through a patch where it meant that we didn't waste any vaccines. That's now closed now, so that's not open anymore. So it's back to the GP and the national booking system in terms of doing those. And then once we've got past the 15th of February and got through all of the first 4 cohorts of patients, that's when we can move on to everybody else and really ramp up the efforts. The other areas that are coming online in smaller numbers at the moment are community pharmacists. So we've some of our pharmacy colleagues out there have put themselves forward to vaccinate as well. So over the next couple of weeks, we'll start to see some community pharmacies coming online as well, giving people more option and more choice to be able to book into centres.
Thanks, Caroline. So I think that just demonstrates the amount of work which is going in rolling this vaccination process out. And there are thousands of vaccinations being delivered in Leicester while still trying to provide general medical services to our patients. And that is immensely challenging. And I think we're very much trying to get all of the groups in the first 4 bandings vaccinated as soon as possible. Could you explain perhaps why there might be still some groups in parts of Leicester or Leicestershire who've not yet had their vaccines, even though they may be over 80, and another part of Leicester where somebody in a lower banding may have received their vaccine? Why is it completely not uniform across LLR, and why do these differences exist?
Yeah, so our population isn't uniform over Leicester, Leicestershire and Rutland, and we've got different numbers of these cohorts of people in different primary care network groupings. And also the rollout into primary care was phased as well, because in terms of the numbers of vaccines available to us. We have been trying to buddy up primary care with each other to try and make sure that we've got vaccine in the right place. But it's actually really difficult to move vaccine. Once they get delivered to one site, it's actually quite difficult to move it to another place. So what we're doing is we're kind of monitoring with that 15th of February in mind, so that we should bring everybody up to a level playing field over the next couple of weeks, and really make sure that we're cracking on through those areas. We have been doing some, I call it jiggery pokery with vaccines this week, and we have found a way of moving things around. So some PCNs some primary care places that weren't expecting large numbers have actually managed to get more this week, so we can start to redress the balance.
Thanks, Caroline. So I think something typical happened fairly locally. So there was a group of practices which had a higher proportion of over 80s. So they had their vaccines first. And then our group of practices received them a few weeks later, and that seems completely reasonable. I think there are issues also with the cold chain process. So one of the vaccines can only be stored in very special refrigerators and be stored at -70, and that also makes it particularly difficult and a challenge to roll this vaccine out. In terms of volunteers, because we need volunteers, how do people sort of register to become volunteers? Because the more people we have, the quicker we're going to be able to roll these vaccines out.
Yes, and there's 2 mechanisms. For volunteers who aren't clinical, Voluntary Action Leicester has got an advert, and I'm sure we'll be able to publicise that. We've had over 1,000 volunteers through that mechanism quite recently. And those volunteers are doing anything from car park monitoring to signposting people on site, and they've been fantastic because they've been out in all weathers, really kind of stepping up, high-vis vests on to support the programme. And I was on a call with them last night, and the energy of that group is just so good. The other mechanism is for staff who will be involved in actually vaccinating people. That's a much more complex process, because we've got to make sure that the competency of those staff meet the criteria for clinicians. So it isn't a case of, I know that we've had some challenges in terms of it's taking a long time to get through the process, and we are putting some additional resource in to try and speed that process up. So apologies to people if they've volunteered clinically and haven't been approached yet, but we do need to do those checks, and some of those people need to go through additional training, etc. But that's definitely speeding up. But those adverts are on NHS Jobs, and there's a rolling advert on NHS Jobs for those. those volunteers there. But also the people who are doing the sense checking and the assessments for those people are the same people who are delivering the vaccines. So, you know, we've got a real chicken and egg issue here. We need to be able to release them to assess competence, but we also need them to do the vaccines. So yeah, we're working on that one as we speak.
That's great, Caroline. Thank you very much for that summary. I think the other thing I just wanted to add is please, please, please do not contact your general practice, because you will be contacted. Today, I think we've had tens of requests which clog up our phone lines for people who are in their 50s and 60s asking for letters that they're clinically vulnerable or clinically in the shielded groups, when actually most conditions that people perceive are not in the clinical vulnerable list. So I would encourage you to go and have a look online as to what clinically vulnerable actually means. And so this is something that we really can't sort of manage in terms of workload at the moment. So we do beg for your patience at this time. So thanks, Caroline. I'm going to move on to Professor Browne, because we've had a few questions around the vaccine and in terms of the ability to pass the virus on once you've had the vaccine. So Professor Browne, once you've had the vaccine, can you pass the virus on?
So this is what we know at the moment. So the important thing is, if you've had the vaccine will prevent you, reduce significantly the risk of you ending up in hospital, ending up being sick, etc. So this is that bit is the known bit. The bit that's more unknown at the moment is, if you've had the vaccine, does that prevent you from passing it on to somebody else? So the way that we are applying this is what we always call the precautionary principle. So that's why when I said earlier on, it's really important that we still do the hands, face, space, making sure that we're caring for other people as a result of that. So yes, it's going to protect you. You know, it's going to significantly reduce the risk to you, significantly reduce the risk of deaths within communities, but you still at this stage need to act really responsibly in terms of being able to potentially shed and pass it on to somebody else.
Another question that we've had, if you've already had coronavirus, do you still need to take the vaccine?
The policy that we're taking here is yes. You know, we still want to make sure that you're protected. I know that there has been some discussions in other parts of the world where they have looked at their priorities and thought, well, in terms of the limited stock that we have, maybe those that haven't. But the plan here and the approach that we're taking here is that if you are in your that cohort and you are called, whether you've had it or whether you've not had it, make sure that you take the vaccine. We've had lots of people that have said, you know, I get lots of people who have said, you know, I didn't get tested, but I'm sure that I had corona. Well, we don't know. So we want to just make sure that everybody is protected.
And final question before we move on to Dr. Nainani. Have you had your vaccine?
I am waiting patiently. I've never been in such a hurry to be older to try and get my vaccine. But I will wait on the list, and I'll wait till it's my time. But suffice to say, I will be front of that queue should that time come for me. And I think that sort of brings me to another thing, really, just to be aware that why it's really important that we respect when we are called. The reason why we do that is about the impact that it has. So, for example, in that most critical group, in that oldest group, when we did care homes first, we're in a situation where, you know, we only have to have a few vaccines to be able to save a life. And I was just going to have a quick look at my data, because it said I was trying to get this information. So yeah, so it says that 20 people need to be vaccinated if you're in that care home group to save a life. But as you go down, you need to vaccinate far more. So if people like me, you know, at that lower level, at that 50 sort of level, you'd have to vaccinate 8,000 of us to save a life. And that's why it's really important that we respect the tiers that they have, so that we are getting to those that are the highest risk, the quickest and saving lives. As we get below that, you know, we will start to get to a state when we're all getting it and that we're all protected. But it's morally, we have to really go to those that are most vulnerable first.
Thanks, Prof. So now we want to talk about vaccine safety, and there's lots of questions on the thread about vaccine safety. And I'm hoping through the course of the answers we give, we can assure you of the safety of this vaccine. So Dr. Nainani, is the vaccine safe?
Okay, so yes, these vaccines are really safe. So these vaccines have actually been approved after being tested on thousands and thousands of people. And in order to actually approve the vaccine, the experts of MHRA really look carefully at all the evidence and make sure that it meets the strict standards of safety, quality and effectiveness. So all the approved vaccines which we have currently in the UK are quite safe. Of course, we have some people who we cannot give the Pfizer vaccine because they might be allergic to the component of the small component of the vaccine, but otherwise it's generally safe. Both the vaccines are equally safe for for the entire population.
Thanks, Dr. Nainani. And you know, the process whereby this was authorised was really quick, and I think that is a route by which people quote that this vaccine is unsafe. So could you please assure us of the process that the vaccine went through that assures its safety?
So yes, so while you might all think that this was rushed, this was actually not rushed. So what we actually did is put all the manpower, put all the funding, put whatever needed to happen, because you know this coronavirus hit all of us like a tsunami, and we really needed some way to find a solution to come out of this. We needed to protect lives, we needed to save lives, we needed to save the NHS. So all the workforce, everything, all the funding, every energy was actually spent to move and get this get the COVID vaccines off the ground, because this is the only light we have at the end of the tunnel. And what I would really like to assure you that it's gone through all the safety things it needs to go, all the quality indicators it needs to pass, and then only it's been approved. So it's really, really safe. And in fact, actually, the first dose, even the first dose, when you get it, you do get protection after 2 to 3 weeks after the vaccine. So it is giving you a high level of protection after you've had the vaccine. So yeah, though it might seem that way, but it's actually not rushed through its quality ways, and it's all the science behind it. So it's really had all the work which needs behind any vaccine to be approved.
Thanks, Dr. Nainani. That is reassuring. So the process was quickened, but not to compromise the safety of the vaccine. And I think one of the best analogies I've heard for Leicester is pre-lockdown. Imagine trying to get through Leicester City Centre at 5:30, but imagine trying also to get through Leicester City Centre at 5:30 with a police escort. The process is going to be quicker. So there's questions on the thread about pregnant patients. Can pregnant patients receive the vaccination?
So we know the Joint Committee of Immunization and Vaccination was looking at this thing, and there has been no data to indicate that there's a safety concern or harm in pregnancy. But obviously when they test the vaccine, they don't really test it on pregnant women and those sort of women, but there's reported no concerns of safety on these women. But what we have said, it's not routinely recommended in pregnant women, but clearly if pregnant women are clinically extremely vulnerable or frontline workers where they are highly exposed to coronavirus, then they should be really considering having the vaccine, because we know that pregnant women, some of the pregnant women, if they're clinically extremely vulnerable, can actually get seriously ill with the coronavirus. So what I would suggest is, if you are pregnant and if you're at high risk and you discuss it with your clinician, both the clinician and patient can come to a mutually agreed decision is the vaccine recommended for them, A, and if it is recommended, is it safe or not? So that's what I would like to say. And in breastfeeding also, there's no safety data, there's no data to say that it's not safe. So breastfeeding women as well can have the vaccine if they're eligible in that high risk criteria.
Thanks, Dr. Nainani. That's really reassuring. So for pregnant ladies, it really depends on whether they are clinically extremely vulnerable And if they are, it's an individual discussion with a clinician to decide as to whether that's the best thing for that person. So really reassuring. Now, we know children can't have the vaccine because the trial didn't include children. And also, thankfully, coronavirus spares children most of the time with the serious side effects. I just want to come into irreversible side effects because there seems to be a big myth. And can you tell us about irreversible side effects? So, for example, there are multiple questions on the thread today about fertility. Does the coronavirus vaccine impact fertility?
So all the data we have had so far in all the trials does say that it does not have any impact on fertility. So that is really, really reassuring that it has actually no impact on fertility, and also no irreversible side effects. So we have done 6 million doses across the country. We have not seen any irreversible side effects. Of course, you can get a bit of a mild side effect like a headache, muscle ache, you know, those sort of things, maybe feeling tired for a day or two, but nothing irreversible. And you probably have more irreversible side effects from actually the coronavirus and getting seriously ill, admitted to ITU, being really unwell, and probably even dying. So, you know, when you look at the benefits versus the risk, you have far more benefits from actually having the COVID vaccine than not having the COVID vaccine.
That's really reassuring. And I think just the other thing to say is that there's this idea of long COVID, isn't there? And we're finding that 10% of people who develop coronavirus develop really quite significant symptoms of COVID over a longer period of time. And 10% is a really, really large figure. And the proportion of people having really mild side effects, or irreversible side effects rather, is very, very, very low. So there's another myth circulating, Dr. Nainani, if you could clarify about the vaccine altering DNA. Does the coronavirus vaccine alter people's DNA?
No, I would just like to reassure you, it does not alter your DNA in any form or way. And also, I think there has been a myth that people feel that they are being tracked. So that is also a myth. You're not being tracked. You can probably be more tracked but through your mobile phones. So just to reassure you, you does not change your DNA and you do not get tracked. So if you get called for the COVID vaccine, and if you're in the eligible group, please go ahead and have the vaccine. It is far more safer to actually have the vaccine than worrying about all these things, because trust me, it doesn't happen.
And I presume as a first frontline healthcare worker, you've had your vaccine?
Yes, I have had my vaccine, and it was actually quite an emotional day for me, because this was the only thing which we can see at the light at the end of the tunnel. We really want to get over this pandemic. We want to meet our loved ones. I mean, my family lives in India, so, you know, I'm looking forward to, obviously, I've not seen them for a year. So it's really that you know, you really need to have this to be able to have your life back to normal. And we never know when that would happen, but this is something, a promising thing for us to have our life back to normal. Thank you.
Thanks, Dr. Nainani. I can see our clinicians are answering every question effectively. So we've had 130 questions posted, and all of them have been answered. So thank you very much for doing that whilst we continue this live Q&A. I'm going to move to Professor Browne, because I think we just need to know how the vaccine works in really, really straightforward, simple terms. How does a vaccine work, Prof. Browne?
So I think what's really important for us to remember is that our bodies are amazing. You know, it spends a huge amount of time fighting off things that shouldn't be there. But occasionally something slips through the net, like coronavirus. And your body doesn't really have the ability, it doesn't have the ability to say, well, what is this? How do I respond to this? Is it friend or is it foe? And what we get through a vaccine is it allows us to create antibodies. It allows us to create things that say, actually, I need to fight that, and allows us to, our bodies to recognize it as foe and to fight it. And it's interesting that the WHO have said on numerous occasions that outside of clean drinking water, the most effective intervention that has happened for population health has been around vaccines. And I think particularly from communities from places like, you know, India, Africa, the Caribbean, etc., you know, it is not beyond our remembrance of the impact that diseases can have, communicable diseases can have. And actually, when we look at vaccines and we look at things that prevent that, you know, is largely welcome. And I've found it interesting that a lot of people, when I've spoken to people back in the Caribbean, they've had very, very low levels. But as the vaccine has become available, they said, oh yeah, you know, my parents are like, yeah, we are there. We're definitely having our vaccine, because they remember what communicable diseases can do. And I think sometimes we have a luxury here that maybe we don't treat them as seriously as we ought to, or we think that we're going to be fine. And I think we just need to remember that, you know, we've got something here that can help us. So we shouldn't be at the back of the queue for this. You know, we should very much be at the front. And I recognise that people will have fears. I recognise that people will have worries. And sometimes, you know, there can be a distrust of authority and all of those areas. And that's the reason why this panel's here. It's here because, you know, it reflects people like you. We are working in this area. You know, lots of the vaccines have been developed with people of colour that helped to develop this. There is no conspiracy around it. It is about protecting those that we love. And the most effective way of doing that is the vaccine. And the great thing about the vaccine is, of course, it allows you to have a strong response. You get a strong antibody response, more so than if you've had the illness itself. And that's the reason why vaccine, from my previous question, why it's also really important to be vaccinated, even if you think that you've had it before, because you'll get a much better immune response from a vaccination than from just having the illness itself.
Thank you, Prof. Browne. And just to reiterate, the trials that were conducted for the vaccines had lots of people from different ethnicities in, and they were international. So that does away with the myth that this is a vaccine for our Caucasian friends, and that is certainly not true. The developer of the Pfizer vaccine was a Turkish immigrant into Germany, I believe. I'm going to go to Zuffar, please, if I may. And I think we just need a reflection from a patient's perspective as to what you're hearing on this panel. So for some reflections, please. We've really, you know, touched upon some serious points this evening so far.
Yeah, it's really reassuring to know that the vaccine is really safe and that so many people have taken it already and that it's actually working, and also that it's preventing people landing up in hospitals and causing death. So the vaccine is making an instant difference to those people's lives. It's the only way we're going to get through this whole COVID-19 and this lockdowns and everything else. And hopefully, after so many people have had the vaccine, life will come back to some kind of normality so that life can go back to normal, because Leicester has been on a lockdown for a long time. A lot of people are quite isolated and depressed. But this is really, truly an opportunity to move things forward. We've got all of the other things, the washing of the hands, sanitizing of the hands, the face masks, the social distancing, all of those things add to the armour to protect us against COVID-19. And the vaccine is a great step forward. I know of, you know, all the sort of religious groups, the Muslim community, the Hindu community, the Sikh community, the Jewish community have all supported the vaccinations. They're all part of the vaccination program, and there's no animal ingredients in any of the vaccines, and it really is acceptable to all religious groups and groups of no religion as well. So it is something that we can really be a game changer and really help us get out of this COVID-19. The reality is we have to do all of these measures. Everybody has to play a part. Everybody has to get involved and make sure they play their part, not only for themselves, but for the rest of their families, because they might survive COVID, but one of their family members, if they catch it, they might not survive. So it's really important that everybody plays their part, moves things forward, adheres to the rules and move forward, and we'll be out of this COVID and be watching Leicester City win another match in a few months' time at the Walker Stadium, and we'll be able to all enjoy our lives again.
Thanks very much, Zuffar. I just want to go to one other theme that keeps coming up, is because the vaccine dosing intervals have sort of changed, the guidelines have changed, and people perhaps just need some reassurance as to why the vaccine dosing intervals have changed, and that the first dose does confer some protection. So if I may, I'm going to come to Andrew to answer that question, just about dosing, and just to reassure our people in Leicestershire that the dosing schedule does allow for a degree of protection after the first dose.
Thanks, Tarek. And it's a really good question, and it's a question that has troubled medics as well. But I've been privileged to attend a number of webinars like this with the medical experts of both the Joint Committee on Vaccination and Immunisation and the MRHA and the 4 medical directors of the 4 nations of the UK. And they've been very open and frank discussions with senior medics who had questions about the decision and wanted to know more and to understand how we arose at how that decision was arisen at. And what is clear from all of the data that those experts have looked at, those very senior people who work with vaccination and immunisation all the time, who analyse the data through the MRHA to look at safety and to look at how effective vaccines are, is that with a single dose, there is significant protection conferred. It is clear that you need a second dose in order to prolong the effects of that protection, but the evidence shows that it is safe to extend the gap between the first and second dose. And the reason for that, quite frankly, the reason that decision has been taken is that because we know that because there is good protection from the first dose, we know we can save more lives by slightly pushing out the timing of the second dose. And that's fundamentally what it's about. It's about saving lives and saving the most possible lives that we can in the shortest period of time. Because if we quite frankly, if we waited and did everybody with a second dose at 3 to 4 weeks, that's a whole lot of people who don't get their first dose, who don't get any protection at all. And that's fundamentally what it's about. It's about saving lives at the end of the day.
Thanks very much, Andrew. So, that dosing schedule is going to actually save more lives, perhaps, than if we dose somebody now and then in 3 weeks' time. That does make sense from a health economic perspective. And only time will tell us those. This is a new pandemic. We've never had to engage with anything like this ever before. And I know that we are doing all we can as healthcare professionals, as other professionals and voluntary sectors to pull our weight to get through this pandemic. We're just going to do a round of some final comments from our panelists. I'm going to come to Caroline first, if I may. So Caroline, any final sort of thoughts or statements you'd like to make to the people of Leicester?
Yeah, I think really watching the conversation in the chat, it's I'm really pleased to see those people who are so keen to get their vaccine and almost can't wait. And I think it's a real shame that we're going through the cohorts in the way that we are, but Ivan did describe exactly why we're doing it, because we're offering that most protection. But it's good to see the enthusiasm there amongst people who've joined us tonight, that they want their vaccines, and we are working as fast as we can. That's the message I want to give people. As fast as it's coming into the patch, we are making sure that it's going out again. We're not sitting on this. So we will get to you as quickly as possible. But thank you for those that are supporting the work that we're trying to do to get as many people to come forward when they're called. So thank you for that.
Thanks, Caroline, for those thoughts. And again, the biggest mass vaccination in living memory, and we're doing all we can to do this for everybody. So I'm going to come to Dr. Briggs, who shared some really sobering thoughts of life from the front line in critical care. So Dr. Briggs, any concluding statements that you'd really like people to take away from this webinar?
So to say, whatever's wrong with you, if you need help from the hospital, we will do everything we can to look after you. But we really, really need everybody in Leicester to do everything they can to look after themselves. And like Dr. Browne said, that's hands, face, space, making sure that they get timely help from any underlying health problems and they don't ignore symptoms that need medical attention, whatever they are. But please do everything you can to protect yourself and to protect your loved ones from COVID and to look after yourselves as best as you can at the moment, so that you're less likely to end up being one of our patients.
Thank you very much to Dr. Briggs for giving us that sobering account, and I very much hope that gives us a real sort of motivation to do what we can to control the spread of the virus. And Dr. Nainani, any final thoughts that you'd like to share with the people of Leicestershire?
So yes, I just wanted to say thank you all for joining us this evening, and it's wonderful to see so many of you this evening. We all know that we have been hit by this pandemic, so you're doing everything you can to support us. So that's fantastic. You're trying to obviously stay at home, washing your hands, wearing your mask. You're doing everything you can to stay safe, of course. And when you do get called for the vaccine, please do go. And if you've got any hesitations, please feel free to contact your clinician to ask anything around it. We're more than happy to support you. Also, to reassure you, your general practice is open. So if you have got any other clinical condition which you think you need care of, you need to speak to your doctor, by all means call up your GP surgery and speak to the doctor. More than happy to discuss any issues you may have or any clinical condition. So we are not closed, we are open, but we are obviously trying to triage on the telephone first and then just see you face to face, depending on your clinical condition. But all of you stay safe and look after yourself, and hopefully we'll be out of this pandemic soon, and it's going to be only with your support that we can do this. Thank you.
Thanks, Dr. Nainani. And I think just to sort of add to that our patrons have been really fantastic with the problems that we're seeing through the door. I would encourage everybody to really consider whether they can engage in self-help before they seek an expert clinician's advice over the phone. The other thing I would just say, please do not contact your GP practices for shielding letters to try and get that COVID vaccine sooner. Don't contact your GP practices to ask when you're going to be given the vaccine. I'm very much hoping that that information will get out to you fairly soon as the vaccine effort is really rolled out. So thank you, Dr. Nainani. I'm going to come to Mr. Furlong. So Andrew, any final sort of thoughts from yourself at all with respect to what you want the people of Leicestershire and even national? We've got national people coming onto this webinar. Andrew, come on. Thanks.
Thanks, Tarek. I think what my reflection of this year has been, it's been an incredibly tough year for everybody, whether you work in health or you in all aspects of our life. But one of the things that has blown me away is the response of the nation and the response of local people in Leicester to how they've wanted to help and they've wanted to support the NHS. And we still have people saying, what can I do to help? And my answer to you now is take the vaccine. That's what you can do to help. That's what you can do to help yourself. That's what you can do to help your loved ones. And that's what you can do to help the NHS.
Thanks, Andrew. And now on to Professor Browne. Any final thoughts from yourself?
Yes, thanks very much. first of all, I just want to thank everybody that's joined us. It's really great to hear about the numbers and how many people wanted their vaccine. But I really want to just talk to those in particular that may have joined us just because they're a little bit hesitant. Really glad that you have. And what I would just say is that, you know, often our fears are largely imagined, but people will try to exploit those, and please don't let people do that. I'm hoping that this evening you heard something that allayed your fears and allowed you to sort of go forward and protect yourself and protect other people. So my final thoughts to you is, even if it hasn't and it's just got you thinking, please come ask one of your health professionals, ask those people that are, you know, they spend their life trying to make sure that you're fit and well. Do those right things. Don't wait for everybody else to have it. Get yourself up in that queue, and don't wait for you know, a herd immunity. We're going to be here vaccinating. My colleagues are going to be vaccinating for some time yet, I'm afraid. And it'd be great if you just make sure that you're safe, you're protected. Continue to follow those public health messages.
Thanks, Professor Browne. And finally, I'm going to come to Mr. Huck, Zuffar. So any final thoughts from your perspective?
First of all, I wanted to say, actually, a real big heartfelt thank you to all the people who are working in our NHS, in the care services. You know, this is a really historic moment where so many people are doing so much work in incredibly difficult circumstances daily. And I've spoken to many families who have lost loved ones at Leicester's hospitals up and down the country. And the one thing that they always say to me, the hospital staff, the people were brilliant. They were fantastic. They've gone over and beyond their duty. They are the true, real heroes that are living in our midst at this moment in time. And I want to say a huge thank you to all the people who work in the NHS and in the care services across Leicestershire for the dedication, the support they give to patients on behalf of patients. Really does make a huge difference to lots and lots of families up and down this country. And as a patient, you know, I would say to everybody out there, the NHS and everybody else is doing their part to make sure everybody survives and doing whatever they can. Please, let's all play our part. Let's do the face, let's do the space, let's do the hands, and let's do the vaccine and move forward, and we'll get out of this COVID-19 and we'll get out of it together. And we can move everything forward, and there is light at the end of the tunnel. Please just carry on doing what you need to do. I know it's tiring, but it's something that we all have to do together, and we can support the NHS by supporting ourselves and supporting our families and keeping safe.
Thank you so much, Zuffar, for those concluding statements. And thank you to everybody for joining this webinar. And whilst it was advertised through Leicester, Leicestershire and Rutland, we've had responses nationally from as north as Bolton to Southend. And we've had thousands of people attend today. Over 100,000 people have died in this country from this pandemic, and you've got a role individually to play to get through this pandemic and save the lives of people around you. If you're offered the vaccination, accept it, follow hands, face, space. We're confident that it's only a matter of time until we return to normality, and the vaccine truly does form that path. Please promote these consistent messages in your local communities. Thank you to our fantastic panelists, our backroom panel, whose names I mentioned earlier. I did forget a couple of names at the start, and thanks to Professor Risha Prasad and Dr. Vinay Gupta also. Thank you to you for joining this webinar, to the LCCCG for partnering the event, to the DMU Willows Centre for Primary Care Research, and to our incredible team who've made it possible to give back to the community we serve. There's a 5-minute video. I encourage everybody to stay on for that, and then we'll draw this webinar to a close. Thank you very much.
Hello, Namaste, Sat Sri Akal, Salam Alaikum. This past year has been the most challenging for many of us. We've suffered in unimaginable ways, and many of us have lost our loved ones.
But we will find our way through this, and we will be united once again with our friends and our families. All we have to do is take the vaccination.
Many in our community have suffered the most, largely due to our efforts on the front line at the NHS or as key workers.
Looking after others and serving our community is what we do. It's how we've been brought up. That's why we have such immense pride when a family member becomes a doctor or a nurse. We have so much respect for them. They need our respect now more than ever. They need our help.
Today, those doctors and scientists have found us a way forward, a COVID vaccine that is safe and will help save lives.
Our community has played our part.
In fact, the scientists who developed the most widely used vaccine are Muslim. Professor Uz Shaheen and his scientist wife, Özlem Türeci from Turkey.
India is one of the global leaders in vaccine manufacturing. Your relatives in this part of the world are alive today because of their trust in vaccines. Should we ask children around the world to stop taking the polio vaccine? No, of course not. So I say if the medics are taking it, so am I.
Now, of course, we have many questions and concerns. Let's clear some of them up.
There is no scientific evidence to suggest the vaccine will work differently on people from ethnic minority backgrounds.
The vaccine does not include pork or any material of fetal or animal origin.
It's important to understand that the vaccine does not contain the live virus itself, only harmless elements from it. And taking the vaccine is the only way to boost the immunity against COVID for you and your loved ones.
The vaccine was available quickly because of a global effort.
Because huge funds were made available by governments around the world. So something that would normally take years to just months.
There are no cases of any significant side effects among the millions of people who have received this vaccine.
It is very, very rare for vaccines to have long-term side effects. What we do know is that COVID-19's long-term implications can be deadly.
The COVID-19 vaccines have gone through the same strict processes and regulations as other vaccines, such as for measles, mumps, rubella and TB.
There is no chip or tracker in the vaccine to keep watching where you go. Your mobile phone actually does a much better job of that.
Pregnant women are not excluded from the vaccine, but should discuss their case with a doctor.
There's also no evidence to suggest the vaccine affects fertility.
Herd immunity is not an option, as many millions will need to be infected, causing a disastrous number of deaths.
The vaccine does not change or damage our DNA. Not taking the vaccine can damage us more.
There may be many other concerns that you have read online or via text message. We urge you please to address these with your doctor.
3 of my aunties and one of my uncles have had the vaccine.
My mum has had the vaccine.
My father, who's 80, has had it. My daughter, who's a medic, has had it.
My dad has had the vaccine.
My parents have had the vaccine.
My sister's had the vaccine, and I'm really looking forward to when it's my turn.
Please help save lives. By taking the vaccine, we will soon be able to live normal lives again.
Soon we will be reunited with our friends and family, provided we do one simple thing: take the vaccine.
Just one simple step will mean we can once again eat, drink, pray and hug together.
Not only will you be saving your life, but you'll be saving other lives too. And there can be no better gift than that. Thank you.